An 8-year-old boy is brought to the pediatrician because of severe dizziness. The patient's blood pressure is 105 over 76 millimeters of mercury when prone and 84 over 59 millimeters mercury when standing, and he becomes lightheaded when rising from a seated position. Testing reveals mutations in the DBH gene and a deficiency of dopamine beta hydroxylase. Which of the following changes in serum levels would most likely be observed in this patient? Go ahead and pause the video and try this question yourself before we go and tackle it. So to understand this question, we have to understand the metabolism of phenylalanine into catecholamines. Norepinephrine and epinephrine are catecholamines which are produced in the adrenal medulla. Phenylalanine is converted into tyrosine via the enzyme phenylalanine hydroxylase. Phenylalanine hydroxylase hydroxylates phenylalanine and requires BH4 as a cofactor, so very nice enzyme name. And a defect in phenylalanine hydroxylase causes phenylketonuria. Tyrosine is converted into DOPA via tyrosine hydroxylase and also requires BH4 as a cofactor. Additionally, tyrosine can be converted into homogentisic acid, and homogentisic acid can be converted into malloacetoacetic acid, which will later be converted into fumarate. And a deficiency in homogentisic oxidase causes alkaptonuria, which is characterized by ochronosis, or hyperpigmentation of the joints and also the skin. Tyrosine, if it is converted into DOPA, can either be converted, DOPA can be converted into melanin via the enzyme tyrosinase, and a defect in the enzyme tyrosinase causes albinism. People with albinism typically have little to no pigmentation in their skin, and something that is important to understand is that these patients have a normal amount of melanocytes. It's simply that these melanocytes are not producing enough melanin. DOPA can be converted into dopamine via DOPA decarboxylase, which requires the cofactor B6. Dopamine then is acted on by the enzyme dopamine beta hydroxylase to be converted into norepinephrine with vitamin C as a cofactor. Norepinephrine is then converted into epinephrine via PEMT, which requires SAM as a cofactor. Keep in mind that this SAM is produced from methionine, which is produced from homocysteine. And this SAM is also important in methylation reactions in order to silence gene expression. Something that is important to note is that people with pheochromocytomas often have an elevation in valine VMA or valine mandelic acid. Additionally, the enzyme cortisol produced by the adrenal cortex, specifically the zona fasciculata, upregulates the conversion of norepinephrine into epinephrine. So now that we understand the metabolism of phenylalanine, let's go back to the question. So here we have an 8-year-old boy who is presenting with orthostatic hypotension. He becomes lightheaded when rising from a seated position. So this patient may be dehydrated. There's a large difference between whenever the patient is standing versus whenever the patient is prone. This patient, they are very nice to us, has a defect in dopamine beta hydroxylase. If we remember, dopamine beta hydroxylase converts dopamine into norepinephrine. So, if there is a defect in dopamine beta hydroxylase, this enzymatic reaction does not occur, and you would have less norepinephrine, less epinephrine, because norepinephrine is converted into epinephrine. Additionally, the amount of dopamine would increase because this enzyme is defunct. So, the correct answer is going to be this patient would experience a decreased amount of norepinephrine, or B. Answer choice A is wrong because this patient would experience increased dopamine from a defect in dopamine beta hydroxylase. C, decreased tyrosine. This isn't true because tyrosine is upstream of dopamine. So if anything, there would be an increase in tyrosine because the increase because phenylalanine is unable to be converted into norepinephrine and epinephrine, meaning that there is a rise in the metabolites upstream of dopamine. So dopamine and all of the precursors to norepinephrine synthesis are going to be elevated. Increased alpha keto acids. So this is commonly seen in what's called maple syrup urine disease. And these patients would have a very sweet smelling urine. And this would have nothing to do with a defect in dopamine beta hydroxylase. This would have to do with a defect in branch chain alpha keto acid dehydrogenase. The amino acids, which are acted on by this enzyme, are isoleucine, leucine, and valine, which requires B1 as a cofactor. An increase in homogentistic acid. This patient does not. What this is describing is a patient with alkaptonuria, and this patient in a defect in dopamine beta hydroxylase does not cause alkaptonuria. So E is incorrect. And an increase in vanillyl mandelic acid. This is commonly seen in pheochromocytomas. And a patient with a pheochromocytoma would have a problem with the adrenal medulla, but would be experiencing things like excessive sweating, fever, hypertension, tachycardia, because adrenergic receptors act on visceral organs such as blood vessels and the heart in order to upregulate the fight or flight response. So since we're not really seeing anything that is consistent with the pheochromocytoma, this answer choice is incorrect.